Hello there. I hope everybody's had a beautiful day today. It has been a beautiful day. It's occurred to me that whilst an inpatient in a psychiatric ward, it's now Mental Health Awareness Week, and it's a time for people to discuss and engage and share their thoughts and their emotions and their ideas and their perspective on mental health treatment and mental health conditions, and to bring into focus the idea and the concept of maintaining good mental health in a society which sort of does its level best, it seems, to kick us all in the nuts, figuratively speaking, and we exist as kind of debt slaves that live to work and work to live, and like it says in the Great Dictator speech, have technology that kind of brings us closer together but sort of leaves us further away. And everybody, I think, for a lot of different reasons, is having real big troubles, myself included, with their mental health. I'd rather not be in hospital. Hopefully I'll be out of this hospital soon. I haven't had a good time here. And I have in some ways. In some ways I've had a very good time meeting the service users. I've met some amazing people and I've got on with the staff. Some of the staff have been really lovely and I've had a good rapport with them. But like I normally do, I have done a bit of research on AI to kind of substantiate the content so you don't just have to watch me talking at the camera for ages. And so let's jump into that, shall we? I asked Gemini, like I normally do in these videos, this. I said that I've read the new Labour government has stated that it intends to reform the Mental Health Act and potentially bring the Mental Capacity Act and the Mental Health Act into closer collaboration. I personally think this could be dangerous and present as a vehicle for erosion of civil liberties due to endemic corruption in psychiatry and various negative press coverage of private sector subcontracting organisations like Signet Healthcare, along with my own lived experience of extremely poor treatment whilst detained under section. As it's Mental Health Awareness Week, what are the potentialities for fraud, deprivation of liberty and human rights risks which could be associated with the Mental Capacity Act and the Mental Health Coalescence if, in a worst case scenario, a healthcare provider did act improperly? I don't know if improperly is a word. And what is the outlook for the Labour government's intentions on proposed reviews or revisions to the Mental Health Act within the scope of this topic? It says it's understandable to have concerns about potential reforms to mental health legislation, especially when informed by personal experience and reports of issues within the system. The relationship between the Mental Health Act 1983 and the Mental Capacity Act 2005 is complex, and any closer alignment would need to be carefully managed to protect individual rights. As we mark Mental Health Awareness Week, it's a pertinent time to discuss these issues. Here's an overview of the potential risks you've highlighted and the current outlook for the Labour government's intention regarding Mental Health Act reforms. Potential risks associated with Mental Capacity and Mental Health Act coalescence, particularly with improper provider action. Closer collaboration or coalescence between the AMHA and MCA, if not implemented with robust safeguards and oversight, could present several risks, especially if a healthcare provider were to act improperly. Deprivation of liberty risks, misapplication of capacity assessment. The MCA is built on the principle of presuming capacity. If providers improperly assess a person as lacking capacity, it could lead to decisions being made on their behalf, including significant restrictions on their liberty without valid consent. Overuse of best interest. While decisions under the Mental Capacity Act for those lacking capacity must be in their best interest, this principle could be misused by a provider acting improperly to justify overly restrictive measures that are not genuinely in the least restrictive option available, thereby unlawfully depriving someone of their liberty. Blurring legal thresholds. The MHA allows for detention based on specific criteria related to mental disorder and risk, but the MCA deals with decisions when a person lacks capacity for a specific decision. If these frameworks are poorly integrated, there's a risk that the stricter criteria for detention under the Mental Health Act could be circumvented, or the MCA-based restrictions could become de facto detention without MHA safeguards. Weakening safeguards. Both acts have their own safeguards. For example, Independent Mental Health Act advocates, who are sometimes good, sometimes not so good. Under the Mental Health Act, Independent Mental Capacity Act advocates, IMCAs under the Mental Capacity Act, and the Court of Protection oversight for the MCA. Coalescence could, if not carefully planned, lead to confusion about which safeguards apply or create gaps in protection, particularly if one act is used to bypass the safeguards of another. Residual liberty, even for individuals already lawfully detained, for example, under the MHA, further actions or restrictions imposed by a provider could amount to an additional deprivation of their residual liberty if deemed arbitrary, as highlighted in the case law of Norfolk and Suffolk NHS Foundation Trust versus HJ. You can Google that at your leisure or stick it into Gemini by all means. Human rights risks under the European Convention of Human Rights, ECHR. Article 5, the right to liberty and security of person. Any unlawful or arbitrary detention or restriction potentially stemming from flawed capacity assessments or misuse of best interests would breach Article 5. Article 8, the right to respect for private and family life. Improperly made decisions about a person's care, treatment, place of residence, or contact with family without their valid consent or a lawful basis under the MHA framework can violate Article 8. The MHA reforms propose advanced choice documents. If these are ignored due to flawed capacity assessments, then the Article 8 rights could be compromised. Article 3, prohibition of inhuman or degrading treatment. Extremely poor treatment, neglect, or excessive use of restraint, as has been a concern with some providers, could amount to a breach of Article 3, especially if systemic failings or improper actions by providers go unchecked. Article 6, the right to a fair hearing. If changes make it more difficult for individuals to understand their rights, access advocacy, or challenge decisions about their capacity, detention, or treatment, the Article 6 rights could be undermined. Article 14, prohibition of discrimination. There are existing concerns about racial disparities in the use of the Mental Health Act. Any new framework must guard against exacerbating discrimination, for example, through biased capacity or risk assessment. Potentialities for fraud or deceptive practices. While the term fraud often relates to financial deception, in this context, improper actions could include misrepresentation of need. Providers might misrepresent a patient's condition, capacity, or the risks they pose to justify continued detention or specific interventions, potentially for reasons such as maintaining occupancy levels in private facilities if funding is linked to this. That's interesting. Falsification of records, altering records related to capacity assessments, consent, application of safeguards or justifications for restrictive practices to avoid scrutiny. The MCA is designed to protect vulnerable adults, including from financial abuse, often through the court protection or by appointing deputies or attorneys. However, the primary concern in Mental Health Act and Mental Capacity Act coalescence is more likely to be around decisions affecting liberty and treatment. Concerns regarding private sector providers. Your concerns about private providers like Cignet Healthcare are echoed in past findings. For example, a 2019 Care Quality Commission review of Cignet Healthcare raised concerns about governance, leadership, high use of physical restraint and seclusion, and failure to integrate policies effectively. More recently, in a 2025 judicial review, Cignet successfully challenged CQC inspection decisions due to apparent bias from an inspector and the CQC's failure to adhere to its own conflict of interest policy. I might have to do a bit of reading on that. These instances highlight that issues can arise with both providers and regulatory oversight, underscoring the need for robust, transparent and accountable systems, particularly if legal frameworks are made more complex. Outlook for Labour government's intentions on Mental Health Act reform. The Labour government has indicated its commitment to reforming mental health services and the Mental Health Act. A mental health bill is currently progressing through Parliament and is anticipated to become law in 2025. This bill aims to implement many recommendations from the 2018 independent review of the Mental Health Act. Key proposed reforms in the Mental Health Bill: greater patient choice and autonomy, introducing advanced choice documents allowing individuals to state their preferences for future care, and replacing the nearest relative with a nominated person chosen by the individual. So it's not going to be done by de facto by the approved mental health professionals anymore. Stricter criteria for detention, aiming to ensure detention is only used when necessary, is of therapeutic benefit, and is the least restrictive option, with clearer evidence of serious risk of harm. Reducing coercion, providing stronger rights to challenge detention and treatment, learning disabilities and autism, new rules to prevent the detention of people with autism or learning disabilities under certain sections of the MHA unless there is a co-occurring mental illness requiring hospital treatment, enhanced safeguards, improving access to independent mental health advocates, IMHAs, and strengthening the role of mental health tribunals. End use of police cells, prohibiting the use of police stations as places of safety. I remember reading last year that the Met Police have completely stopped doing section 135 and 136 detentions. Now they just don't do any mental health work, the Met Police, anymore. I've been put in a police cell after having been apprehended by the police for mental health sections a couple of times. It's not very nice. Labour's broader mental health commitments. The party has expressed intentions to recruit additional mental health staff, improve access to services including through community hubs, and focus on early intervention and prevention. Mental Health Act, Mental Capacity Act collaboration in the reforms. There is a recognised need for better joined up health and care planning, particularly between the Mental Health Act and the Mental Capacity Act, as they often affect the same individuals. The MHA bill incorporates elements that interact with capacity. For instance, the ability of a person, including those under 18, based on competence, to make an advanced choice document or appoint and nominate a person is linked to their capacity and competence to do so. The principles underlying the MHA reform, choice, autonomy, least restriction, are also central to the Mental Capacity Act. Addressing your concerns within the scope of reforms. The stated aims of the MHA reforms to increase patient rights, choice and safeguards and to reduce coercion and inappropriate detention are intended to address many of the types of the risks that you're concerned about. However, the success of these reforms will depend on several factors: effective implementation and resources, significant investment in workforce, training and infrastructure will be needed. Cultural change, moving towards a less coercive and more rights respecting system, requires a shift in culture and practice, not just legislative change. Clear guidance on the Mental Health Act and Mental Capacity Act interface. If there is to be closer collaboration, clear guidance and protocols will be essential to prevent confusion, ensure correct application of the law and protect individuals' rights. Any ambiguity could indeed create new vulnerabilities. Robust oversight and accountability. Strong regulatory oversight from bodies like the CQC and clear accountability for providers will be crucial. Just been on the phone to the CQC today. They are kind of good. Like, I got an email back from them a few weeks ago and it just sort of said something along the lines of like, you won't hear from us from a long time and we're not going to do anything about this issue, which was a bit kind of alien when I saw that. Anyway, it goes on to say the reforms are generally seen as a step towards a more modern and rights-based mental health system. However, ongoing scrutiny, active involvement of service users and advocacy groups in the implementation process and a continued focus on protecting civil liberties will be vital to ensure that any changes, including closer working between the MHA and the MCA, genuinely improve care and safeguard rights rather than creating new avenues for their erosion. Full implementation of the reforms is expected to be phased in over several years. I've always said, well, I haven't always said, but I've said a few times the last few months, mental health, there are places in the world where, and it used to be the way in this country, where people that go against the status quo, against, you know, hegemonic figures and, you know, people who have power in society, you know, people who have influence, and they make accusations against them. You know, in the Victorian times and in some developing nations around the world, the profession of mental health is used for censorship and oppression and repression and human rights abuses, you know, and it's kind of always going to lend itself to that, I think. Like, there's always going to be, there's not always going to be, but like, I think, you know, there's always a percentage of people who go through mental hospitals who actually have nothing wrong with them and have to, you know, the men in white coats, the old classic stereotype, you know, the men in white coats come and take people away. And, you know, when they used to incorporate the Mental Capacity Act and the Mental Health Act together, there would be times where people could be literally stripped of their assets. You know, you'd try and make an allegation against the mayor in Victorian England, and the men in white suits would come and drag you away, say that you were insane, you had an unclean mind, and they'd take you off to a sanitarium, and you'd lose your business and your property and your bank accounts and everything. And I think it's really important that we don't go back to a place where that's possible. I've been in sections before where staff have just openly lied, you know, to me about historical and factual events and things to do with my own family life and my own personal history. They've just said, no, that didn't happen. You're wrong. You're delusional. What you're saying has no basis in truth. And like, it has been the truth. And that's felt really oppressive and difficult. And it's like, you just want to fucking headbutt somebody when they say shit like that. You know, it's really difficult to deal with, and they don't have straitjackets in this hospital, and they've treated me really well, and I've, you know, in some ways, I'm incredibly lucky to be alive. I almost died in July 2024, and I've had a couple of quite severe wobbles since then too, and there are a lot of different reasons for that. Some people know more about what they are than others. And people have been sympathetic, and they've been kind, and they've been honest to a certain degree, but they've also been duplicitous, manipulative, abusive, and underhand, and, you know, the way things have gone, I'm really sort of not happy with at all. Like, you know, it's just like, what I was going to say, I've always said, isn't what I've always said, but I'm going to say it like I have said it a few times before. Mental health is a bit like a kitchen knife, you know, like you might argue as long as there's vegetables that need cutting, there will always be knife crime. You know, you can use a kitchen knife completely peacefully and calmly to make a nice curry for you and your family, and every house has one, and, you know, it's something which can always be used, you know, in a completely holistic and beneficial way. You know, a kitchen knife makes food. I used to be a chef. I love cooking food for people, and, you know, everyone loves eating together, and it's a nice thing. But like, knives take lives too, you know. People misappropriate and misuse knives, and knife crime is probably never ever going to stop, you know. And they're probably, without sounding like too much of a pessimist, you know, for Mental Health Awareness Week, trying to be optimistic, trying to be, you know, thinking about the future of mental health care, I think there's probably just always going to be like situations where people do get dragged away by the men in white coats, and get told to stick to a plausible narrative by a criminal infrastructure which is affecting psychiatry through an organised crime and fraternalistic socio-economic demographic network, which has, you know, held powerful people in positions of insulated hegemony in Western society for the last 500 years. And like, I want that to change. I want to stick it to the man and stand up against institutional corruption and institutional abuse and power structures that ruin people's lives, ruined my life and turned me into a really kind of destructive, negative, sad, and more recently suicidal man. And the help that I've had with that, you know, people who go and work in mental health or any kind of healthcare, like NHS workers, are fucking heroes. Do you know what I mean? If you can help somebody out when they're having the worst time in their entire life and they want to start becoming self-destructive and those emotions manifest, if you can help somebody to veer out, pull out of that nosedive and kind of get on with their life, then, you know, there is no salary that's really going to make up enough for, you know, the value and the intrinsic worth of that career path. And so I think people who work in mental health and mental hospitals are fucking excellent for that reason, you know. I've had a lot of, like, the opposite, actually, you know. I've had mental health treatment that's made me worse, that's made me deteriorate, and I've become institutionalised, and I've suffered poor treatment. It's actually made my mental health worse being in mental hospitals, and that has sometimes been from sort of focused and intentional attitudes and actions of people who I believe have acted improperly, but I won't focus on that. But yeah, make curries, guys, make curries. Use your kitchen knives, use the Mental Health Act, the Mental Capacity Act, and your holistic ability to care for one another in a responsible and loving way, and let's push things forward and help make the world a better place and stop people languishing in their pajamas, being pumped to the eyeballs of medication in corrupt and insidious, depressing facilities, fleshed out with people who don't want to be there, both being paid a salary and as patients. And get yourself a brand new set of chef's knives, read some Jamie Oliver books, and let's make mental health treatment something that we can all be proud of, rather than something that's terrifying, insidious, shameful, and needs to change.